Hi, everyone. Oops, excuse me. Sorry. All right, there we go. Hi, everyone. Welcome to Facebook Live. Wearing my mask all the time like I'm supposed to. So we are here to answer your questions. We'll start out with the data. I do want to welcome Mark White. Excuse me. Back to Mark. Hi, Mark. Mark is our deputy director. My fearless co-leader, Justin, is out fighting floods, I believe, today. So Mark will be here to answer the emergency operation type questions. So, all right, back to the data. We have a total of 8,323 cases with over 6,000 recovered, and we're up to 229 deaths and a total of 477 hospitalized. Of note is that our hospitalization rates are significantly reduced. I think our volume is well under 10% at this time, and our emergency transportation systems also report reductions in transportation of COVID patients. So I think we're safe to say that we're definitely seeing the tail end of this last wave peak. We have the curve here, which shows that reduction. What a long few months it's been, huh? To see that high peak and then coming down and then plateauing there and coming down again. We are seeing steady declines throughout the state as well. So I do think this is something to be grateful for. Our testing and case positivity rate is here. Our testing is down. Our testing capacity, though, is still very much alive. We still want people to get tested if they feel ill or have had an exposure. And our testing positivity rate is now 5%, which is coming down as well. So we hope to see less cases over the next several weeks. This is our vaccine distribution graph, just to show that the number of people who've had first doses versus second doses. We're going to see that yellow segment of second doses going up steadily. This week was a very big second dose week of vaccinations for us. And in fact, well over half of the vaccines we distributed this week were second doses. So we'll start to see this distributed pretty evenly. And we've also seen vaccine distribution between the hospitals and local health departments in a similar type distribution pattern. So our dashboard, as usual, go to this. You can also get updated vaccine information on the number of vaccines that we are distributing. When I say distributing, I mean vaccines we're putting in arms, administering. We also will report on how much vaccine we're receiving. And that, of course, continues to be the bottleneck with vaccine allocations from the state. So we'll continue to let you guys, in fact, I'm sure we'll talk a little bit more about that today as well, how much vaccine we're getting and what we hope to do with it. So let's get right on to our questions.
All right. Hi, everybody. I just wanted to start off with last night we made the announcement that we are finally going to have our new pre-registration system in place on our health department website starting tomorrow. It'll go live at 9 a.m. So Doc, can you talk a little bit about that? You have some talking points in front of you about a few talking things that people might want to know.
So not to get into the weeds too much, but I do want to say that we spent a considerable amount of time with every person I could think of that had knowledge about a system like this to try and find the quickest and the best solution. And we made, I think, a wise decision, and thanks to our Board of Commissioners and to our county administration, and especially to our Emergency Operations Center crew, Mark and Justin and Russ, we decided to purchase an Everbridge model that is in functioning throughout the country already in very many locations. And this registration system, I think you've decided to call it a pre-registration system, but it's basically a place where you can go and register yourself for vaccine. It doesn't mean that you have an appointment. The appointments will still need to be assigned to you based on whether or not you're in the eligibility group that we're currently vaccinating, as well as how much vaccine we have available. So an important point is, as everyone gets onto the system and registers, there will definitely still need to be some patience. It doesn't mean you're going to automatically get a vaccine appointment. We still can only provide vaccine appointments for the amount of vaccine we have, but at least during the queue, and we know who is there, we'll be able to look at that and say, okay, we've got 10,000 people we need to vaccinate over the next X amount of time, and we can focus and plan accordingly. So the pre-registration does save you a spot, and you'll be notified based on the information you put in there. You'll be notified what your appointment date is, when, the location, etc., when that appointment comes up. So anybody who lives in St. Clair County or who works in St. Clair County is welcome to register, okay? And that will be part of the registration process. So if you're just visiting from Florida and you don't live here and you don't work here, you can put your name in there, but you're not going to actually get a spot as a result of that. So that's the beauty of the system. You know, we don't have to have an individual person screening through all these things, and the system will do it for us. So those of you who are struggling with going to, and this is, by the way, will be on our website, scchealth.co, where you've been going for the other scheduling links in the past. So those of you who can't do this or have difficulty with this, we're asking you at this time to call 211 and or to call the Council of Aging, our local Council of Aging, and they will assist you. But they're going to use the same registration link on our county website as you would. So if you can go to our website yourself, please do so. As you can imagine, right now, those two resources have limited operational capacity as well. And so if you can get somebody to help you get onto our website and do this process, I am pretty comfortable that this is a straightforward registration. You type the thing in, it takes you to what you got to do next. You put submit, and there you go. So I'm really comfortable that this should not be a really difficult thing. And it's certainly not something where you have to go back and refresh and be there right at the exact right time, is what so many of you are struggling with before when you were trying to get appointments. So it doesn't matter if you go in there at 2 a.m. or 5 a.m. It doesn't matter what time. You put your stuff in, and it's entered into the queue. So that's the system. I don't have a name for it. I don't want to call it the Everbridge system because it's going to be ours, but we'll come up with a name for it soon. And please be patient. So, and I also want to say that we developed this as quickly as we could because we didn't want to get behind on the vaccination clinics, but we know there's more work to do even with the system that we're putting up. We actually just put the bare bones up so we could start using it right away, and some details about it that I'm sure we're going to find out need to be adjusted and changed, and we'll be doing that as we go. So I know you'll find those details and let us know what's wrong with it, and we'll work with you as we move forward.
Okay. I just wanted to just let people know that for the 211 option and Council on Aging, we ask it's for people who are 65 and older, who are struggling, who don't have computer access, who just can't figure it out, versus the rest of the general population. So Council on Aging, I also just wanted to say they want us to say this phone number, 1-800-297-0099, if somebody wants to call that option if they need help with pre-registration.
1-800-297-0099.
Yes.
Right? Okay.
Yep. Okay.
And we will put those numbers up as well, and we'll post them in our social media feeds. And I think we probably need to have all of that on our website as well. The other question that we get a lot, the other question we get a lot is, well, where else can I go? And those places are also going to be expanding as vaccine distribution expands. So right now, as you know, McLaren Hospital has vaccine that they're distributing to the community. So you go on the McLaren website and you find their log, and you got to log in that way. I don't know if there's a way to call and make that appointment for them. Probably not. You have to use their website. So they have a limited number of vaccine they're using. Myers right now does not have vaccine vaccine for the general public, but they do have a waiting list. So you can go on the Myers website and get on their waiting list. And as we go through this process, I think in the next week or two, we were just announced that there's a new federal pharmacy program that's being launched that in Michigan will be the Rite Aid stores. Initially, there's not going to be a lot of vaccine going into these pharmacies. And I don't know if any of St. Clair County's Rite Aid stores will be selected to be part of this. But that's one thing. So we continue to look for pharmacies and other community partners that will be willing to vaccinate as well, and so that you'll have more choices. Those clinics will probably not be huge, right? The large clinics will be doing for the community based on our allocations. But I just want to put, so as those develop, if they're permanent places you can go, we'll also continue to list those on our website as well. Okay.
Doc, one thing you had mentioned that I just want to clear up for people as well is when they go to our website, the link will be called pre-registration for COVID-19 vaccine, and that's the link that they will click on when they go to our website.
There you go.
Okay, Mark, you're familiar with this system as well, so we are just going to answer some common questions that we're getting. So if somebody was asking, can you sign up both a husband and wife at the same time, or will you have to sign up on different accounts? Can you answer that for us?
Absolutely. So currently the way the system is set up, husband and wife would need to create separate accounts in order to sign up for their for the prerequisite, to get signed up for the vaccine. I'm sure that down the road there may be an option to do that, but at this point in time, that's where we stand.
Okay.
This system that we're utilizing is pretty robust, and we are not the first in the nation to use that. So Everbridge is used in multiple other communities around the country, and so we have great confidence this getting all pulled together, and it's been used in other communities, and we just St. Clair County-ized it, so to speak, and make it work for our county and for our residents. So I think we'll see some good successes with that.
Okay.
And along with that,
Mark,
too,
can you
go ahead. Sorry. Yep. I was just going to mention about each person that registers has to create their own unique password and username as well. So just to make sure that a husband and wife team don't try and use the same username and password is pretty important. Everyone has their own unique sign-in.
Okay. Another question, Mark. This person asked, can I sign up on the new website even though I'm only 64 and it will keep my information when it's my turn? Can you just reiterate that again? Doc had mentioned it.
So, yep, anyone can sign up for this. And once again, the way the system is built, it'll actually categorize you into the different groups that we currently have. And say if you're, 64 years of age and your birthday's in 3 days, well, it'll take into account that, yep, you turned 65. So, things like that. It's the pre-registration is simply what it is, getting you in queue, making sure that if you want the vaccine, you've attained a spot for that. And once again, based upon age and whether you're an essential worker like a first responder, nurse, doctor, things like that, that still has a higher priority. But all of our citizens are important, and for those that want it, this system is going to help end some frustration in people that are trying to obtain a Friday afternoon lottery and see if I got into the system for that next vaccine dose.
Okay, thank you. Somebody asked a good question. Do you think that if there's so many people tomorrow trying to register when we go live at 9 a.m., will the system crash?
So we are praying that doesn't. Yeah. So Rusty Crease is our guru when it comes to Everbridge systems, and they are extremely robust. They can handle, the messaging system alone can handle thousands of requests at a time. In fact, even when we do paging or messaging for our community for severe weather or whatever type of alerts, that handles multiple thousands of people. Over 100,000. So
And I did ask that question
System.
when we were trying to decide on what kind of product we should move towards. And this system is up and running in Sarasota, Florida. And we were able to look at that. And if you think we're going to have a rush of people here, you can imagine in a Florida community, there's quite a bit of. They had the same situation we did. So, and it worked quite well. So I'm never going to say never, but I am very optimistic. Not cautiously optimistic. I'm very optimistic.
We should be very good. Yeah, we should be okay.
So I'm just going to go through some more questions that people are asking about it. Will it be a first registered, first served, like first come, first served system?
Yeah, that we have to do that. We can't base it on, if an 83-year-old should go before a 72-year-old. And I know sometimes, there's categories of risk, but I can't make that decision about who has a greater risk than another. So if you're over 65, and you get logged on and we have a clinic for the first 500 people next week, we're going to pull the first 500 people off of there that are eligible and just keep working our way down.
Okay. The next question on that was, one moment, please. Can I sign up an elderly relative? Do I need an account for them only?
Right. So each individual who's in the system that's in the queue for a vaccine needs to have their own username and password. So you could do it for an elderly relative and just put their username in and come up with a password that, is simple enough, or write it down for them. I don't know what the requirements are for the password, whether it's 8-symbol. Some of them need uppercase and lowercase. Do you guys know the details of that, whether it's going to be that, or somebody can use their birthday?
It's pretty simple. I believe it's at least one uppercase, one lowercase, and I think a number possibly, and
a letter,
a symbol.
And how long?
It'll come up on the system what it requires. Okay. There's a little bubble box.
So yeah.
Somebody also wants to know.
We'd encourage people to sign up other people. I think that would be really helpful to help people sign up.
Yeah, definitely. Anyone can sign up, anybody, if they need help. Somebody also wants to know, and maybe Mark, maybe Doc, you might know as well, but what kind of questions are going to be asked on the new system?
Well, they're going to be all the questions.
Go ahead, Doc.
Go ahead.
Go ahead.
No, they're going to be all the questions we need to, number one, put you into the MCIR system, which is required by law. When we give a vaccine, we have to put the vaccine dose into your system under your name. So your legal name, your date of birth, and I believe we ask for previous names as well. And that's because, and the reason we ask for a previous name is because you may be in the MCIR system back under a different name, and we don't want to make multiple inputs for you. We want to put all of your vaccine history together in one place. We want to be able to merge it, and our staff knows how to do that if they have that information. And then general demographics, which we are required and we should be following, not just race and ethnicity. I think there's male and female.
Yep,
don't think
address,
there's a whole lot
phone
more
number.
than that. Address, phone number. We obviously are going to want to know where to contact you, right? So you're registering or pre-registering, and then you're going to have to be contacted when your appointment is. And that may not be for a while. So you need to make sure that we have a way of sending you that information. And it could be by email. I think there's also an option there for texting, correct?
Yes.
Texting and calls. So if you have somebody else registering, but it's your grandmother and she wants to be notified herself when her appointment is, you put in the contact information that grandma needs, right? So that information goes to her. And then there is the categorization of priority groups. So right now we can't vaccinate everybody. It's 65 and older. So that information. And then there's the pieces for essential workers. So we're in the group B, 1B. So that group of essential workers will be listed. You can mark if you're part of that. If you're not part of that and you're part of a different group, you put that down, and then your name would get pulled when we start vaccinating that different group. So I believe that's it. I don't think there's going to be a lot of anything other than what we need to know in terms of how to vaccinate you. I do also think, Ross, did we get that insurance information in there? I know that was a question.
Yes, that will be included.
Okay, and that is not because we are going to get rich vaccinating people. We are not billing for the vaccine. The vaccine is free. If you have insurance, we will bill your insurance company for the vaccination administration. And actually, we haven't even been doing that. We may not do that for a while, but we want that there because it's an option for sustainability. But if you don't have insurance, there will be no charge to you. And so no risk or concern about not having the ability to pay for the vaccine. But we wanted that in there.
Yeah, no out-of-pocket cost.
Expense. Right.
Yep.
Did I miss anything?
Someone wants to know if there's going to be questions about chronic illnesses.
Yes, we did build that in there because, as you know, the Group 1C is adults with chronic conditions. So, yeah, I believe that will be in there.
Doc, someone also wants to know, what did you mean? What is the MCIR system?
The Michigan, what does C stand for? I always forget. Community Immunization Registry. So every state has a statewide system to keep track of vaccines, and ours is called the MCIR system, the MCIR. It's been around for several decades, and it is what allows us to look and keep track of what vaccines a person has. So it's a beautiful system. It works very well, and it'll tell us, for instance, if you had a vaccine 10 years ago, what that was, and whether you need boosters. So by law, every COVID vaccine is required to go into the system within 24 hours. And that's the way we're able to keep track of how many people are getting vaccinated. It also allows us to keep track of who needs second vaccines. So it is a system where we can send out reminders if people forget to come back and get their second vaccines. It's a very, very helpful system.
Hey, Mark, could you talk a little bit about the appointment options, if you know this or not? Someone wants to know, how are they going to know about their appointment? So Doc had mentioned about you could put your phone number, your text, your email, but then how does it work?
So the beauty of the Everbridge is once you've got that encoded into the system, whatever you put in, it captures that, and your preferences can be, I want to get a phone call, or I want to get an email, or I'd rather get a text. That's how Everbridge works. That's why it's such a great system. It'll do multiple platforms, just depending on personal preferences of our citizens. You know, those that how they get a message. Everyone's a little bit different, so that's how this will work.
And it will be an automated phone message, so we want people to answer the phone.
From my understanding, yes, that's
yes.
going to happen. So, yeah.
And a text or an email. Somebody wants to know, too, what if they're contacted and given a date and time and they can't make the appointment? What happens?
You want to do it?
So,
yeah.
So what's going to happen, that'll probably be a phone call to the health department and say, I can't make this, or you get into your account. I'm not for sure the details. Russ maybe be able to answer, but I know there's going to be a mechanism in place to reschedule your appointment. So
my understanding, okay, go ahead, Russ. Go for it. Yep.
What will happen is when a person is up, they will get a message and ask if they are available for a certain appointment time. The answers will be yes, I can make that appointment. No, I still want my vaccine, but I cannot make that appointment time, or I've gotten it somewhere else. If you cannot make your appointment time, you will be contacted again. You do not go to the back of the line. You will just be up for another phone call coming up in the near future.
Yep. So you just
don't lose your
back
spot.
in the queue.
You don't lose your spot.
Right.
Yep. But you get put back in the queue in the front where you were before. So you don't lose your spot and go all the way to the back of the line. And I think that's important for people to understand. And from my understanding, this happens all automatically, which is another beauty. So that means you don't have to call and talk to one of our poor bedraggled call center people. We're getting hundreds and hundreds of calls a day. Now, you can just do it automatically and be confident that you're still in the system and you'll still get a vaccine appointment.
Okay, so let's talk about this question. Who can go in there and pre-register? And again, it's not live until tomorrow at 9, Friday at 9, but is this going to be for anybody, or are there certain groups that are going to be contacted differently? Do you want to just talk about that?
No, everybody can pre-register. Now, I gotta say, we have carved out a very special process for our teachers. And if you are part of that process, I don't think you have to pre-register because they've kind of taken care of that and have everybody in the queue and they're ready to kind of move the teachers through. But if you are a teacher that's not part of the public school system or one of our charter schools, then you would be welcome to use this system. Now, besides teachers, we have not really established any specific click vaccine process for any other special groups. We've been focusing on 1A, but if you are any other group, any other person, you just put your name in there and you put the details that it will come up with, what you do and who you are and how old you are, and it will, the system will categorize you based on who we're currently vaccinating at this time. So, and if that's too confusing, if you're a teacher and want to go in there, do it. And if you get an appointment and you've already got vaccinated, then you just decline. I mean, personally, I don't care where you get vaccinated as long as you get vaccinated. And we just won't need a system where we can work through people in a very efficient way and not have to spend hours and hours on the phone. As you know, it became kind of an impossible task to respond to everybody. So this is a way of automating that response. You want a vaccine, you go into the system, put your information in, and when it's time for you to get that vaccine, you'll be notified. If you no longer want it or if you've had it somewhere else, you just respond accordingly and we move on. So I think, quite honestly, I don't think it matters who you are. If you feel like you need a vaccine and you haven't any idea where to get one, this would be the system to put your name into.
Yeah, we've seen a lot of people talking about how they've gone on different pre-registration systems and put their names in anywhere they can find, right? But what's the kind of the point to drive home? You kind of already said it a little bit. So let's say one of those venues contacts them that they're up. What should they do about the other places who they've also been put on lists? Should they just blow them off? Should they cancel?
So I don't know. I was going to ask that question to Russ. If somebody who is being really conscientious and got their vaccine through a different pharmacy and they were on our list, if they could go back into our system and take their name off. And I don't know that is an option. I don't know if Russ knows if that's an option or not.
That is an option, but
Okay.
Remember when the notification gets set up, they have three choices. They can make that appointment time, they can't make it,
Right.
but they still want it, or they have received it somewhere else. And if they make that as a reply, they are automatically taken out of the system.
So that's another way. Just wait until you get an appointment time and decline it and say that you don't need to be on our list anymore. So that works. Now, what the other systems are doing, I honestly don't know. I don't know what the McLaren system does or what the Myers system does. But from my understanding, they're kind of similar. I think the Myers system for sure is very similar. I'm not sure about the McLaren system.
Somebody also asked, how is like the automated phone call from the health department, well, it's actually from the system, going to be displayed on someone's caller ID? And we're still kind of working out that process, and we will notify the community because we have not determined that.
It's a good question. So I know with the WIN system, which is also the Everbridge system that Russ and Mark were talking about. So when I get notifications from the WIN system about any emergency, they send me an email first. And if the email isn't responded to, it goes to my phone. If it doesn't go to my phone, it goes to my work phone. It just kind of keeps going right down. And I have to respond before it stops bugging me. And it comes across with a very specific informational tag that's where it's coming from. So I guess that's a good question because I think everyone will get the same kind of information when it comes back to them. And I don't know whether it's going to say ever wins or what. I don't know what it's going to say. I'm sorry. It'll say something that we will tell you about soon.
Yeah, we will notify you as soon as we know.
How's that?
Okay.
So
Somebody
if we
again
get
wanted.
news, yeah, if we get news from Everbridge and what the prefix codes will be, we can work that out with Russ and get that put out to our folks via a press release or whatever. So if you see a phone call from such and such area code and blah, 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 I mean, that's probably, our notification system for your vaccine.
So what will
Good question.
when somebody goes into pre-register, because you always have to worry about scams, what will the system not ask people? Just so if somebody is worried about what are they going to ask me, what are they not going to ask me? I put in the press release last night, we're never going to ask you your social security number, your financial information, your credit card information. None of that will ever be asked. And if
Right.
someone's
Correct.
asking you for that, that's not us.
Correct. Yes. Yeah. None of that really important private details will not be incorporated into the system. So even in our regular warning information notification system, none of those details are ever captured. So same thing with this. That stuff is not part of what we do.
Somebody wants to know, is the pre-registration process timed? Will I be booted off if I type slow?
I don't believe so. I think you have the ability to respond at your speed. So yeah, there won't be a timing factor included with that.
Yeah, people again need to remember this is not making an appointment like we used to have. This is
Correct.
pre-registering yourself for a future opening.
Correct. So
Okay.
when it comes time for the callback, like Doc had said, that there may be, depending on your preferences of how you wish to be notified. Say if you don't answer your email in a certain time frame, then it's going to go to your phone, then your cell phone. They're going to text you and whatever. Those processes can be timed out and sit there and notify you in whatever succession. At least that's how WINS works. It gives you so much time to reply, and if you don't, like you said, Doc, it keeps bugging you until you confirm
Yeah.
the message. So yeah.
Just thinking out loud, another question I don't have, and I'm just going to ask the question in case you guys want to know what I don't know the answer, is what happens if somebody gets an appointment and doesn't respond at all? So we send them their appointment time, they don't accept, reject, or take themselves off the list. And I guess that would be another
I believe
operational
Russ knows
question.
that.
Do you know, Russ?
Right.
There will be a time limit for somebody to physically accept the appointment time. They do not have an appointment until they accept it, and a confirmation message is sent back to them.
Okay. So the worst that would happen is somebody just wouldn't get their appointment spot.
Correct. And they would not go to the bottom of the list. They would be
Okay.
next up for the next clinic.
Yep.
Okay. So they would just get another notification. That's good. That's really
Yes.
good. Okay.
I think it's going to be an hour. The time frame will be 1 hour before it moves on. Go ahead, Mark.
And just one other comment too regarding this whole system, that if you do not have a confirmed appointment, please do not show up at the clinic. I mean, that's
Yes.
the whole key to this, that you just don't show up and say, oh, I thought I had an appointment, and that can kind of make the process move that much slower. So make sure you've got a confirmed appointment in your hand before you show up at that clinic site.
Speaking of appointments, Dot or Mark, one of you can answer this. Where will the vaccine locations be, and how do I know which one to go to if I'm able to register? I heard you're not going to be using the convention center anymore, and that is false. So
That is false, right? Yep, that still be utilized. And I know staff at the health department is working judiciously on securing other sites around the county to make it easier for our residents to get to various locations, out west towards Capac, Yale, Memphis, downriver, central around Port Huron area. So there's multiple sites, multiple venues, and all of it depends upon a dosing amounts that are received for the week. And how much are we able to distribute, and what's the best locales to get those centers set up. So a lot of logistics that happens in the background. You got to get staffing, personnel. I know there's been talk of National Guard being out to help, with whatever functions are necessary. So there'll be locations throughout the whole county.
Now, one of the
Right.
goals of the state for the vaccine goals, along with vaccinating a certain proportion of people in a certain period of time, but one of them is to make sure that vaccines are available no further than 20-minute drive from where a person lives. So that is something that we have to address in our system. But I suspect as we go forward, we have ample vaccine, and we're not just kind of picking one clinic location a week to distribute, or two, that we will be looking at where you live and trying to assign clinic locations for you that are within 20 minutes of where you are. So that is an issue that we need to consider.
And I just want to give a shout out to the convention center, because we have been using them as a regular spot, and they have been absolutely awesome. So thank you, St. Clair County Convention Center. There's awesome. And also the Washington Life Center we've used and we'll use again. So thank you for that. Okay, I've got a couple other questions here. Let's see. When will people with underlying conditions who are under 65 be up for their vaccinations?
The state's expected timeline would suggest that 16 to 64 with risk factors would be in May. Now, those are presumptive guidelines, and certainly not something that is a hard and fast rule, but clearly you are down the line. And priority groups may still be adjusted based on what we see with the data. So stay tuned.
And we've been getting a lot of questions from people who might have medical health conditions but aren't at the right phase yet, and so that's kind of confusing for the public too, because that
there is no
priority group is
there's
not up.
age. There's age. So you
Can
can
you
be
explain
a
that?
healthy. You can be a healthy 65-year-old, or you can be a 65-year-old with multiple medical conditions. Your multiple medical conditions are at higher risk, but you are both equally eligible for vaccine. And we do not have sub-priority groups within the 65 and older group. Some counties have kind of gone that way. Some have even said 75 and older, but we've just kind of kept it at 65 and older and keep trying to plug away at that. We've got about 30,000 of you guys, and we're just going to keep working away at it until we get as many of you vaccinated that want to be vaccinated. So if you're 65 and older, regardless of your underlying health conditions, you are now eligible for vaccine. There are no medical priority components to this at all. And same for the essential work group. It's based on what you do, not based on what problems you have. So our work groups for essential workers are skilled nursing care facilities, hospital staff, all of those groups, and healthcare workers, the teachers, first responders, which are your firefighters, police, etc., correction workers in our jails and our juvenile justice systems, and workers in homeless shelters. Also, your congregate child care centers are in there as well, and adult and child protective services. So child care workers are part of that. That is it. Those are the essential workers we're working on right now. And I know that it has been altered. We have some communities that are doing things differently. But as a county, we are trying to just stick to the guidelines. I think it creates a lot less confusion, and honestly, I think it's the most fair way to do this. The state has established some guidelines. Most of the counties and the hospitals are following these guidelines, and I think that's just the best thing we can do. Once we get through some of this, and like for instance, we have a special clinic every week for essential workers, and the slots aren't getting filled up, believe me, we will start moving on right away. So we haven't seen that yet, but maybe in the next couple of weeks, we'll be shifting over and doing most of our vaccination clinics to focus on the 65 and older. Since so far, we've been kind of distributing our vaccine about 50-50 So about 50% of our vaccine has been going to 65 and older group, and the other 50% we've been using on all of our essential workers. But as we get those essential workers done, we're going to shift a lot more of that vaccine to the 65 and older and just really focus on y'all.
Okay.
So I hope
Somebody
that helps.
somebody wants to know too, if they're a cosmetologist or hairstylist, where do they fall? Because they see people face to face in close proximity every day. They're phase 2. They're
Yeah,
from
they're
what
phase
my
2 general
understanding.
population. Yeah. Yeah. Well, it depends
Okay.
on their age. So if you're a cosmetologist and you're over 65, you can get vaccinated right now. Okay. But if you're not, then you probably have to wait until the general population gets opened up. It's really
Okay.
not all based on your risk. Unfortunately, you'd like to think, well, if I have more risk, more exposure, I should be able to get further ahead in the line, and that's just not the way it's rolling out.
Okay.
There's an attempt for that, but it's not exactly that.
All right. Now I'm going to go through these questions that we're getting on the live feed.
Good.
All right. How many vaccines are going to be available for next week? I don't think we even know that yet. Do we?
Did anyone look on MCIR today? I heard that they were starting to be posted. So I certainly don't expect more than what we received last week. In fact, some of my colleagues in other counties are saying they've received less, and I'm kind of waiting and hoping that that's not the case. But we received about 1,000 doses, new first doses. We also received all of the second doses we requested. But those second doses go to the people who've already had their first doses. So I think what people are interested in is how many first doses are we getting every week? Because that's what is going to be made available to you all through the system, right? And last week it was 1,000 doses, and I suspect this week it will be somewhere around that. Hopefully more.
Somebody wants to know, when are we able to make an appointment for the second dose appointment? Do we have to register again in the system, or will we know, will it be scheduled at the first vaccine?
No, the second dose appointments are scheduled, if you get them through us, they'll be scheduled at the time you have your first dose appointment. So you'll walk out of there knowing when your second dose is, and you don't have to go back in the system. Now, the question is, if you get your first dose through a different place and they're no longer available, or you're having difficulty getting it, and we have to work out a system for that, because we want you to be able to get your second dose. Preferably you get your second dose from where you got your first dose. But if that's not working out, we will have to make sure that we have a system to get people scheduled into the second dose clinics. And I'm not sure exactly how. If they get their first dose from us. I'm talking about people who don't get their first dose from us and are looking for their second dose. There needs to be a way for them to reach out to us and get their second dose, is my point. And I'm sure that will be worked out with our system. In that case, you probably will have to go into the system and get an appointment. Oh, no, that won't work because you need a very specific time. All right, we got to get back to you about that.
Yeah. All right, somebody wants to know, why is Michigan timeline different than the other states where younger people with conditions are already getting the vaccine? Is Michigan getting less vaccine, or do they have more older people?
I don't know. I have nothing to do with the federal allocations to the states and how they work that out. I'll just stop right there. I don't know.
All right. All right. Is there a timeline when the second vaccine must be administered if the second appointment is missed between?
I wouldn't use the word must, but the recommendations are to get that second dose within 6 weeks of when it's due. Okay, so if you get Pfizer, your second dose is due in 3 weeks, and then 6 weeks beyond that. So your second dose is due between 3 and 9 weeks. Okay, of your first dose. Moderna, your second dose is due at 28 days or 4 weeks. And so 6 weeks out from that is 10 weeks. So if you're a Moderna recipient, you get your first dose, your second dose should be between 4 and 10 weeks. Now, if you miss that mark, it doesn't mean you can't get your second dose, and it doesn't mean your second dose doesn't count. What it means is we just don't have the data. We don't have the information we need to be able to reassure you how effective that vaccine really is. We do know that if you get it within that 6-week period of time, they were confident that the vaccine will still work as well as it did in the clinical trials. But if you go beyond that, we just don't know. I can tell you, though, historically, in many, many situations, vaccines given well beyond that due date are very effective. We just don't have the data yet to be really reassuring about it. So if you miss it, don't panic. Just go get it as soon as you can.
All right, we had this question last night and then again today. Where do veterinarians fit in? According to CDC, we are 1B, but I'm not seeing that filter down to local government.
1B, Group C probably is what we're probably going to put you. There's been a lot of discussion about this. We value our vets. We know you're important. And Group C under 1B is other frontline essential workers other than the ones I just mentioned. And that includes food and agricultural workers. And I would consider veterinarians to be essential for the whole animal husbandry kind of world. So 1C. And I would think that might open up before the general population, I would assume, but we'll wait and see. According to this timeline that the state put out, the other essential frontline workers are also listed as an estimated first dose administration in May. So it's hard to say. You know, I brought that up at a state call and said, really, that's a long time away. And they were just kind of like, well, we'll see what happens. So stay tuned.
All right. Somebody says or asks, once you get your appointment, you show up for your appointment, about how long before you are sitting down and getting your vaccination? All these old people who can't move or stand for long periods of time.
Well, you guys have been a lot of our clinics. I'm proud of the way they run. They run very effectively and efficiently. Sometimes there's bottlenecks that are hard to control for, but I think for the most time, in and out in an hour, way less than an hour or less.
30 minutes,
Yeah.
15, 30 minutes.
They're very
30
efficiently
minutes.
run.
Yeah.
Mm-hmm.
Yeah, less than an hour. Yeah.
Now, with the, please, if you're bringing an elderly person who might need a wheelchair, please bring that equipment. Mm-hmm. We do try to have wheelchairs and things like that there, but we only have so many. So please remember to bring something like that if it would help with that appointment.
Can you talk about, too, that when you get your vaccination, that there's a short waiting period when you're after you're finished? Can you talk about the reason why and the 15 minutes per se?
Yeah, so we want to make sure that there are no reactions to the vaccine. A 15-minute waiting period is standard for all vaccines, okay? And that's because people who sometimes get vaccines, they faint. And those kinds of things we don't want to happen in a parking lot or while you're driving. So this is just standard precaution for, honestly, any injectable medication. That's true if you get a penicillin shot or anything else. So vaccine, 15 minutes is standard. If you have a previous history of a severe allergic reaction, we call anaphylaxis, you are asked to wait 30 minutes. And so those individuals, we just want to give a little extra time to make sure you're in a place where we can properly respond to your needs. It's a lot harder to respond to a problem if, like I said, if you're already out in the parking lot. So please comply with those. And I've noticed that we tell people how long to wait. Most people are just kind of told you can leave at such and such time. And it's not like we sit there and, lock you in. It's kind of asked you to do that voluntarily. But it is helpful for you to wait. All
right. We are at around 4:20, and we've got quite a few questions. So want to try to roll through these a little quicker. Number one, how are the flu numbers in our county right now?
Very low.
Okay. Let's see. After you're vaccinated, can you be a carrier of COVID?
We don't know. I don't think there is such a thing as a carrier. I don't think carrier states have been identified. But the real question is, can you become infected and transmit the virus and not know it? And we don't know. Possibly, possibly not.
How long is your immunity after you get the vaccine? Is it for a year like most flu vaccines or just a few months?
Well, it's more than a few months. Although the studies, I think, have only gone off 6 months, and I think the vaccine efficacy is robust at 6 months. So we are hoping a year, but I'm going to answer the same way I answered the last one. We really don't know yet.
Okay. The city of Detroit is already offering the vaccine to store workers. Why is Detroit so far ahead of St. Clair County? As a senior citizen with a major immune issue, I can't get the vaccine here in my county.
Well, let me just say I have no control over what Detroit does. They march to their own drum, and local municipalities do have choices they can make based on their vaccine allocation. So I'm not going to comment on Detroit. What I will say, shoot, I froze. Okay.
Nope.
What I will say is that we are prioritizing 65 and older. The whole reason why we've gone to such great effort to get the system in, we want to make sure that if you're over 65, you have access to this vaccine within the next month or two. Okay. And we're really going to work very hard at making sure that happens. So I think that is the appropriate priority group right now is our 65 and older. And that's what we're going to continue to work on.
Okay. If you own a second home in St. Clair County and pay taxes here, can you register here for a vaccine?
Yeah.
Okay. What happens if our status changes from non-essential to essential? I'm a public-facing civil servant, but are being told to hold back. If we're deemed essential by the federal government, the employer, should they reach out to the health department?
Go ahead and register. Put your work, what you do as an employee in there. There'll be a field where you can type in what you do, and if things change, we can go into our system and we can extract new groups. So I would just say go ahead and use the system and put down who you are and what you do, and as soon as we can, we'll get to you.
Okay. And the last question I see is, why is it so hard for my 89-year-old mother to get a shot?
Because we don't have enough vaccine for everybody. And the system that we had was really clunky, right? We had a system where really people who were very tech savvy and knew how to go on our website, knew how to schedule an appointment, were the ones that got appointments. So I'm hoping this new system will stabilize that a little bit more. But let's face it, we have maybe anywhere from 200 to 500 doses per week historically to give to 65 and older. As we move forward, I'm hoping to get that closer to 1,000 doses, but it's just not enough vaccine yet to get to everybody. So I'm hoping this new system will be more equitable and be a little easier for some of those real older people to get to.
All right. The last question is this going to be up on the website all day for sign up?
All day, every day, 24 hours a day. It'll never leave. It will be there all the time till the end of eternity, until we are done trying to vaccinate the community with COVID.
Okay.
It's not going anywhere. Okay.
It's not the same what we were doing. Okay, so we're done. Mark, do you have any closing comments?
So yeah, thanks Doc and company for allowing me to be on today. I just ask for everyone's patience as we go through this new sign-up process with Everbridge. We have a lot of confidence here at our office, and trying to make sure that we have a very robust product for health department standards. That's really important, and to make sure that it meets the needs of our community. We know there's been a lot of frustration. We know there's a lot of anxiety, and hopefully this system will relieve some of that pressure and thought process and get people on the path to getting vaccinated. So that's what I have to offer for today.
Thank you. Doc, can you address this in your closing comments about what percentage of St. Clair County has been vaccinated as well?
Oh, 7% of our population has been vaccinated, which is really astounding. I believe last time I looked at the actual known COVID cases were a little bit over 5%. So we've actually vaccinated more people than we know have had COVID. And I'm hoping to see, obviously, that vaccination number increase exponentially as the vaccine comes in. We are very successful in turning around whatever vaccine we do get, turning it into a vaccinated population. So I don't think that's the concern. I think the concern is fighting for our fair share of vaccine allocations. And we're in the field doing that. And I just want to, as a closing comment, just thank all of you for your questions, for your patience, for your belief in science, that science does have answers and solutions, even though there's a lot of unanswered questions. It's hard to be in this place where we have so many I don't knows. But we are really starting, I think, to see the beginning of the end. But remember that this is still a long journey ahead of us. This is not going to be over in a month or 2 months. We're probably going to continue to have problems through the spring. But we've got a tool now that I think is going to be really effective, and hopefully with the Everbridge system, it's going to be a lot less frustrating for all of you to get access to it. So thank you for your patience.
All right, we'll see everybody next Thursday at 3:30.
3:30.